You've signed up for gynecomastia surgery, but have you discussed with your surgeon all the steps that they take to make sure you get a great result? Because there's one step that will make or break your gynecomastia surgery. So let's get into it. If you're watching this, you already know that gynecomastia is an overgrowth of breast tissue in men that gives you more of a female appearance to the chest. And if you watched our gynecomastia 101 video, you're already an expert on this whole topic. Now, in general, this tissue does not respond well to weight loss and most often needs to be surgically removed for best results. So how is this surgery done? Gynecomastia surgery can be done in two different settings: awake under local anesthesia here in the office or under general anesthesia in the operating room. After the area is numbed, I make a small incision along the bottom of the areola where the darker skin meets the lighter skin of the chest. I almost never extend my incisions beyond the nipple region. The reason I don't do this is because I want these incisions to be as inconspicuous or as stealthy as possible. I want you to be able to take your shirt off on the beach and not have your scars be the center stage of your new chest. Occasionally someone will need the incisions extended, but for 95% of my patients, we don't need to do that. The scars stay right in the areola. Once the incision is made, I leave about a 1 to 1.5 centimeter area of tissue beneath the nipple to help support it and minimize the chances of having deep depressions under the nipple after everything heals. From there, the gland is all directly excised from the areas that we marked out where the gland was felt. But here's the step that you cannot miss out on. A good amount of you are going to need liposuction of your chest first, with gland excision second. If you just do direct excision of the gland, there is a good possibility you're going to be left with what's called a saucer deformity. No one likes this, and to correct it, you have to wait about 6 months for the area to heal and possibly have 1 or 2 rounds of fat grafting to the area to correct it. Liposuction of your chest is key to getting great results with this procedure. And there are 2 key areas that you need liposuction to hit a home run when it comes to gynecomastia surgery. The first area that I address is the lateral chest wall. A good amount of men with gynecomastia have excess fat trailing off into the underarm area and lateral aspect of the chest. I make about a 2.5 millimeter circular hole in the underarm area because, again, I want these incisions to be as stealthy as possible. From there, I can run my liposuction cannula along the side of your chest and really empty out the outer edge of your pec major muscle so that the aesthetics of the border can really shine through when it heals. The next major area that I address with liposuction is what's called the inframammary fold. It's a fibrous area of tissue that causes your gynecomastia to fold over on the lower part of your chest. The main purpose of lipo in this area is to break up that band, as men don't really need an inframammary fold. It also helps with skin retraction in the area and can flatten the contours of the upper abdomen to give you even better results. The rest of the chest, such as the inner portion of the pec major region and upper portion, are also areas that I liposuction just to make sure that we have a good overall contour when we get done. Now, not everyone needs liposuction for their gynecomastia. Some of you have the glandular tissue located right under the nipple and have low body fat percentages anyway. But for a lot of us guys, we're going to need liposuction to enhance those results. So now that you've had your gynecomastia surgery, here are some tips I give to my patients to help with their recovery and help keep them on track for great results. I'm Dr. Paul Pearce. I hope you learned something here today. I'll see you on the next one.